Good afternoon, Mr. Smith.
Oh, hello.
I have a prescription here for you for Xenical, is that correct?
Yes.
Okay, and is this the first time you're taking Xenical?
Yes.
Okay, so because it is the first time that you're taking Xenical, there's just a couple of things that we have to go through. For example, just a little bit of an information session regarding the medication. So basically Xenical, the active ingredient in this drug, or in this formulation is orlistat. It's in the capsule formulation, and just regarding the way it should be taken, the Xenical capsules should be taken 1 capsule 3 times a day. So that's with meals, for example, at breakfast, lunch and dinner.
What happens if I miss breakfast?
Okay, if you miss breakfast, that's a very good question. What we do is we do not take the capsule if you miss the meal. That's the same for lunch or dinner. So if you miss a meal, we don't take the capsule, because in effect the capsule won't help, or the drug, the orlistat, will not actually have any effect if there's no food being digested. So just to go over how it works, orlistat inhibits some enzymes in the body that are produced by the pancreas. So basically it limits the amount of fat that is digested and absorbed into the body. By taking the capsule with a meal, the food that is digested and the fat that would be absorbed is inhibited from being absorbed, and so it just passes right through. In effect, the amount of fat in the diet is reduced. And so the weight loss occurs by this decreased fat absorption. So the body relies on its own stores to generate energy and function well. So with the Xenical, taken 3 times a day, if you miss a meal, you do not take the Xenical. And just with some other information with that, if you do snack between meals, it's best to avoid salty or fat-rich meals.
Does this mean chips?
Yes, exactly. Chips, fried goods, anything that is involving sort of like potatoes or meats that are high in fats. Avoid these. Stick to fruits and vegetables as snacking items, because they contain less fats and there's an increased chance of the weight loss with the Xenical. So you're expected to observe the weight loss within the first 3 to 6 week period. The weight loss will continue for the next 6 to 12 months and then will be sustained. So we just have to...
How much will I be losing?
It depends. Each person is different, depending on how strict you are with this medication program and how much your intake is. So it is very dependent, and in your case we would hope for about a 3 to 4 kilo loss every 2 to 3 months. So it's a steady decline in the weight. So just some things to note with orlistat. It's quite well tolerated. However, if you do feel any side effects of the medication, they're more likely to be abdominal or stomach or digestive related. For example, things like dyspepsia, a little bit of reflux could be associated with that.
What does that mean?
Basically, you just get a little bit of heartburn. And dyspepsia is just this uncomfortable feeling, bloating, that sort of thing. The other thing you do, or you might get, is abdominal cramping, which is just a bit of pain in the stomach area. You can also get diarrhea. And
that's not good.
Yes, but with the diarrhea, it's really, for the weight loss to occur, it is one of the side effects that will happen if the intake is too high in fat. So what we would like to do is minimize the amount of fat that you take with your meals, and then as a result, the diarrhea will be reduced. And if you note that the diarrhea is quite profuse, and you're getting this sort of oily discharge, then we would go for a reduced fat intake with your meals.
Can't I just take anything for the diarrhea?
No, it's best not to, because the diarrhea isn't actually being caused by any particular disease or pathology. It's quite simply just fats not being absorbed, so they start to just come out into the stools, into the toilet. So to try and stop that, we just want to decrease the amount of fat in the diet. So just a couple of lifestyle factors with Xenical. It really only works if you do reduce your overall fat intake, if you reduce the snacking in between meals. And the other thing is just to avoid any high sugar or high fat intake drinks as well, and products as well.
Does that include Coke?
Yes, it's best to avoid those as well, because Xenical not only helps with weight loss, but it also helps with the reduction of your cholesterol, your good cholesterol, bad cholesterol. So the good cholesterol is increased, the bad cholesterol is reduced, and then your blood fats is also reduced. So by decreasing the amount of sugar you take as well, there is less conversion of the sugars to fats, which occurs most commonly in obese or heavy individuals. So did you have any questions with Xenical?
How about Diet Coke? Is that still okay?
Diet Coke should be fine because it doesn't contain the sugar, which would usually, in the case of lack of activity, cause conversion into fats. The other thing to note is that lifestyle improvements, such as increasing your exercise, also just increasing the general mobility, will also help. So you become healthier as well as also losing the weight.
Okay, just one other thing.
Yes.
My daughter also seems to be suffering from an overweight problem.
Yes.
Can I give this to her as well?
It's best not to, unless she's come and seen either myself or another healthcare practitioner or the doctor, because each individual has their own circumstances, and especially for children, especially under the age of 18, it's completely contraindicated, which means we do not give it to them.
Okay.
Only if they're over 18 and if their body mass index, which is the ratio of their weight to their height, is over a certain amount,
Okay.
then only do we recommend Xenical.
Alright, thank you very much.
Okay, you're welcome.